Welcome back. Now, the word osteoporosis comes from Greek. It means porous bones or bones that have holes in them to the point where they become so weak that they break or they fracture. Now, the disease itself has probably been around for thousands of years, but the word osteoporosis was just starting to be used in the early 1800s. The root cause of osteoporosis is when not enough bone is maintained or too much bone is lost. And as we know, bone is a type of tissue. It's part of the skeletal system. It gives the body its framework. Calcium and vitamin D are taken from the blood to make new bone, and this whole process is controlled by various signals in the body, including hormones. Because osteoporosis is largely a silent disease, it kind of goes on the inside, patients can't really feel it. It's usually picked up on scans, or patients can get a fragility fracture, which are fractures with even minor trauma. So, for instance, a patient will turn around to shut a door and they will actually get a hip fracture first and then fall. The risk factors for osteoporosis are many, but by far it's in women above the age of 65. Alcoholism, smoking, vitamin deficiencies, certain medications like steroids and antacids, carbonated drinks, or other diseases, especially hormonal diseases like diabetes and a thyroid. Is genetics, it can run in families, and kidney disease because kidneys process the vitamin D so that it is usable for the rest of the body. The diagnosis of osteoporosis is made through a bone density test or DEXA scan, which is just a test that does fancy x-rays of three different parts of the body, and it comes up with three scores. Now, the first number compares the patient's bone to normal bone. The second number compares the patient's bone to bone that is matched by age and gender, etc. And then the third number gives a risk number, like this is the patient's risk of having a major osteoporotic fracture in the next 10 years or hip fracture in the next 10 years. Because research has shown that those patients above the age of 65 that have a major fragility fracture have an increased risk of death in the first 6 years after the event itself, which brings us to treatment. So, treatment of osteoporosis is not just about maintaining that bone or making it stronger, it's actually preventing those fragility fractures in the first place. There are many medications, supplements, treatments, etc., which we will get into later. As far as the long-term prognosis of osteoporosis, if it is caught in time, the prognosis is very good. But once these fragility fractures occur, they can become very painful. Patients can have chronic pain, chronic disability. In the case of hip fractures, up to 20% can die within that first year of the fracture itself, which is why in this disease in particular, preventing further bone loss is probably best. As Tony Stark said, it's not about how much we lost, it's about how much we have left. Until next time.